One of the questions we have to answer sometimes is like, what affords you to make a smaller incision? Like, what is minimally invasive and how do you do it? It all depends on the navigation and how you image things before you make your incision. So we used to use an x-ray, or you just by palpation feel on the patient's back and say, well, this is where the L5S1 disc is, and this is where the iliac crest is, and so the incision should be from here to here. After that, you could use, later on, it evolved and just use like an image intensifier, which is a portable x-ray machine, and put a couple needles and say, well, this is where I need to be. So now we have even more sophisticated navigation, and this unit here is called an O-arm, sophisticated portable CAT scanner. We call it 3D imaging. And what happens is we're going to put an antenna into the patient's iliac crest, which is bone, fix it, and then take a bunch of pictures. And we know that the antenna is fixed in bone, and all our instruments will have a reciprocal antenna, so to speak, so they talk to each other, and we'll have a camera. So then we know exactly where we are within a few millimeters just from pointing on the skin. So you can map out your incision and keep your incision smaller. And then we have special retractors that help us to get down there and keep the tissues out of the way. So it's pretty much navigation is the key to doing minimally invasive surgery.